Welcome, everyone, to the launch of Tell Your Story via live stream and also here in person. We're delighted you were able to join us for this. This report is a compilation of 110 lived experience stories of women and gender diverse people accessing abortion and contraception care across the Grampians region. I'm Marianne Hendren, the CEO of Women's Health Grampians, and I'm delighted to be joined by over, I believe, around 50 people on the Zoom and many here in the room as well at Federation University Horsham campus. And thank you to Federation University for making this space available to us. We're very grateful. And in saying thank you, I also want to acknowledge that we're here on the traditional lands of the Wachabaluk, Jadwa, Jali, Wagaya and Japagok people. And I want to pay respects to their elders, past and present, and any community members that are with us here today. I'd like to acknowledge Aboriginal and Torres Strait Islander people have been are the oldest continuous living culture and that sovereignty was never ceded. This always was and always will be Aboriginal land. You can see on the slide, hopefully, the beautiful artwork that was done for us recently for our Reconciliation Action Plan at Women's Health Grampians. And that artwork was undertaken by a woman from who lives in this region, Tanisha Lovett, a Gunditj Mara and Wachabaluk woman, and I'm sure you'll agree it's very beautiful. And on the way in here today, I also noticed that the building we're in has beautiful writing and artwork that was also completed by Tanisha. So all in all, she's a wonderful, talented woman that we're very, very proud and pleased to have a good relationship with in this region. So over the next 90 minutes, we're going to hear from several people. We will have opening reflections from Jessie Duncan, who's a PhD candidate here in Federation University. We'll also hear from Stephanie Cooper, the Women's Health Grampians project lead for Tell Your Story. And Stephanie will share insights from her analysis of the report. We'll then have a panel discussion and where we'll be joined by Sharon Cook, who is a well-known nurse and advocate in this region. We're delighted that Sharon was able to join us today. Dr. Kathy Tischler, who's the lead researcher at the Future Regions Research Centre, based here at the Horsham Hub of Federation University, and Dr. Juliana Betts, who's a public health physician with the Grampians Public Health Unit. After the panel discussion, you'll have the opportunity to put forward questions using Slido, and you'll get instructions as to how to do that very soon. We did it this way in order to provide a safe space for people to ask questions of any of our speakers. And we will endeavour to get through all the questions today before the end. Can I just remind people who are here in the room to make sure that your phones are set to silent. And I also want to let you know that we do have media present in the room as well who'll be reporting on the event, but not necessarily identifying anybody from the audience. So, without further ado, I think it's time for me to introduce Jessie Duncan. Jessie is a former journalist and, as I said, a current PhD candidate here at Fed University, studying the impact of rurality on the rates of gendered and family violence in the Wimmera Southern Mallee region. And that's a piece of work that is proudly co-sponsored by ourselves at Women's Health Grampians and seeks to unpack the fact that we do see disproportionately high rates of family and domestic violence in rural and regional areas. So hopefully Jessie's going to shine some light on that down the track. But for today, Jessie is going to share some reflections on this report. So, and it's based on the fact that she has been gathering local stories as part of her PhD work. So I guess it's an extension of that work that she's going to share with us now. Thank you, Jessie.
Thanks, Marianne. So first of all, a huge congratulations to Stephanie and the team at Women's Health Grampians on the completion of this much-needed report. So, as Marianne said, my name is Jessie Duncan, and it's a pleasure to be here with you all today. Prior to making the somewhat questionable life choice to start my PhD while raising a toddler, I was a journalist in the Wimmera Grampians regions. I've seen firsthand the role that media can play in bringing these important stories to light. Quite often in rural areas, there are things going on that have a significant impact on our communities and on our individual lived experiences. The media has an important role to play in connecting people who might not realise that others are having similar struggles. And the media can also put these issues on the policy agenda. But there are some stories that are harder to tell than others. Asking a woman or a gender diverse person to share their story around birth control or abortion is a huge ask. These stories are personal, and they come with a lot of vulnerability. Publishing under the condition of anonymity is risky in a region with a low population where it's easy to identify someone. Often, the best option that we journalists have is to publish a story based on statistics, but that robs us as a community of the chance to fully explore the barriers and the service gaps at play, because statistics can only tell us so much. This is why the Tell Your Story report is such important work. It brings together a range of diverse voices from across our region, and it unites them in speaking out about the barriers they faced trying to access sexual and reproductive health care. And it does so in a safe way, a way that preserves anonymity and unites us all in their experiences. Contraception and abortion access is a really important issue that often comes with experiences of stigma and isolation. And what women don't necessarily know is that other women are having similar experiences to theirs. And if those experiences are collected and compiled, a powerful narrative emerges that highlights the serious gaps in the service. That narrative tells us, to pick just a few, the ways the various aspects of the healthcare system, such as travel, appointment wait times, continuity of care and cost structures, interact to create additional barriers for anyone seeking sexual and reproductive health services. It also captures broader barriers like the lack of private or public transport to travel to clinics outside the region, or the lack of childcare if you need to travel or recover from a termination of pregnancy, not being able to afford the days off required for travel and recovery, not being able to consistently access the same GP, and a lack of access to healthcare practitioners with up-to-date information and training in abortion and birth control options. These are all barriers that disproportionately impact rural women, particularly in the Wimmera, Southern Mallee and Grampians regions. And the stories in the Tell Your Story report help us to understand the ramifications of inadequate access to sexual and reproductive health care. The Tell Your Story report builds on a proud and successful tradition of using narrative to ensure each woman has proper access to sexual and reproductive health services. So we're going to time travel for a moment back to New York City and the first successful use of storytelling in the campaign for abortion and birth control access. In 1969, a group of radical feminists known as the Red Stockings organised the first Speak Out event in New York City, and it was called Abortion, Tell It Like It Is. This event put the issue on the American national agenda, and it had a broad ripple effect internationally, including in Australia. In Victoria in 1969, abortion was still a criminal matter, but a clarification was made that stated abortion could be legal if it was considered necessary to preserve the woman from a serious danger to her life or her physical or mental health. It would take another 39 years for it to be fully decriminalised with the passing of the Abortion Reform Act in 2008. But decriminalising, whilst a definite and clear step in the right direction, isn't the same as providing safe, informed and effective access to abortion and birth control services. That is something that the Tell Your Story report brings into light in no uncertain terms. The Red Stockings demonstrated back in 1969, and this report demonstrates now, that when women have a space where we can safely tell our stories, we take an active role in deciding how the issue is discussed and what the priorities should be. We are able to have a dialogue with decision makers and push for policy decisions to be relevant and equitable. When we tell our stories, we open the doors to acknowledging and addressing access to sexual and reproductive health from within an intersectional framework that gives weight to the lived experiences of women that may otherwise fall between the statistical cracks. It also means we can come together to discuss these issues without the stigma and isolation that so many women still experience when trying to access birth control or termination of a pregnancy. It shows us the power of telling your story. So again, a massive congratulations to Stephanie and the team at Women's Health Grampians, and a massive thank you to all the women and gender diverse people that shared their stories for this report.
Thanks so much for that, Jessie. Really powerful context setting for what we're about to go on and discuss. I'm hoping the live stream is working okay. I think there may have been a glitch or two there. So hoping everyone's on board. So next up, I'd like to introduce Stephanie Cooper. Stephanie is the project lead at Women's Health Grampians for Tell Your Story. She has been with us for about the last 12 months or so, and this has been the key focus of her work during that time. And Stephanie's going to provide us with insights around the 5 themes that have emerged from the stories that have been submitted to us. So really looking forward to hearing your reflections, Stephanie. Thank you.
Thank you everyone for being here today and for joining us online. I would like to tell you a story. Once there was a woman who found herself looking for a new job after having a bout of illness. And after being a registered nurse for over 10 years, she wasn't so sure about moving away from the clinical bedside. What were the chances that she would be able to find something that she could do that aligned with her personal values and her passion for women's healthcare? But she took a chance and she applied for a job at Women's Health Grampians as a Sexual and Reproductive Health Promotion Officer. And that is how I came to be standing here today, and I'm so pleased to be able to share with you the results of this report. When I learnt that Women's Health Grampians wanted to hear more about women's lived experiences, I thought, great, everyone appreciates a good story. We know that stories are much more effective at changing minds than statistics and numbers on pages. But I knew that if I wanted to hear women's stories, I needed to create a space where women could share their experiences openly and honestly without fear of judgment or stigma. This is what led to the creation of Tell Your Story, which we conducted via an online survey where women and gender diverse people shared their stories while remaining anonymous to allow them to be completely open and honest with their experiences accessing abortion and contraception in our region. So it's been 12 months now of surveys, analysis, interviews and research, and it is my privilege to present these results to you today. But we wouldn't have any of these results if it wasn't for the 110 women and gender diverse people who so generously allowed themselves to be vulnerable and shared their stories with us so that we could use those stories collectively to inspire greater change in our region. We have a snapshot here of the 110 participants from Tell Your Story. We had participants from all 11 local government areas that Women's Health Grampians covers, and we had participants ranging in age from 18 to 22 up to 44, 45 years of age. Of our participants, 9% identified as living with a disability and 12% told us that they had a chronic health condition. 13% identified as belonging to the LGBTIQIA community, and 14% were born overseas. Of these, 1/3 of them told us that English was not their first language. At this point, you might be looking at this slide and saying, Steph, this looks a lot like statistics, and I thought that this was going to be about stories. And you'd be correct, because the point of Tell Your Story was to complement existing statistics with what they cannot tell us, which is the whys and the hows behind the how manys and the wheres that we get from statistics. This is why when you read the Tell Your Story report, which is available in hard copy if you're joining us in person today, or can be downloaded from the Women's Health Grampians website, you will find that the second half of that report is dedicated to the stories that were shared with us today, and that they have been arranged according to 5 themes. You can see these themes here. We have availability of appointments, accessibility of healthcare, particularly relating to cost and the need to travel, stigma and privacy, information, education and training, and also pain, pain relief and sedation. So starting at the start with availability of appointments. Overall, 45% of participants told us that they could not easily get an appointment to see a healthcare provider. And I want to stress that this is not a criticism of any individual healthcare practitioner or healthcare service, but rather a reflection of the ongoing shortage and strain that our healthcare system is under. It is well documented that we have a shortage of GPs and nurses and midwives, and this statistic that 45% of people in our region could not easily access appointment shows us that addressing that shortage is a matter of urgency if we want to see these numbers improve. My local clinic isn't taking new patients, but the clinic in the next town over won't take me because I'm not local. We heard this story again and again from women in all different regions, all different towns, and this is not a problem that is unique to any one pocket in the Grampians. Participants told us about how long wait times and difficulty getting appointments created feelings of frustration and hopelessness, and conversely, that those that were able to get appointments easily reported relief and satisfaction in their service and care. Another correlation that we noted was between confidence in privacy and confidentiality and access to a regular healthcare provider. Participants who were able to easily get an appointment were 5 times more likely to report that they would be confident that their confidentiality would be maintained than those who did not have a regular healthcare provider. Continuity of care is one of the main tenets in both general practice medicine and nursing and midwifery. It is clear that in this instance, it is both healthcare practitioners and their patients that have the same goal in mind, which is to build an ongoing relationship so that we can have difficult conversations if need be, and know that we will be able to trust that our private information remains private. There was other strong correlations noted in the report when we used the confidence in appointment availability as a measure, and I really encourage you to read through that report for more details on those. Renee Bracey Sherman, who is a prominent abortion rights storyteller based in the United States, once said, "The abortion clinic can be right across the road from your house, but if you don't have somebody to watch your kids or you can't afford it, it doesn't matter." And this quote really stuck with me when I was analysing the answers that came through on this survey, because I saw this sentiment echoed from all across the Grampians region. Our survey showed that cost of accessing abortion and the need to travel was a significant barrier for the majority of our survey participants. Women spoke of the difficulty caused by the need to travel and the complexities of juggling childcare and work commitments. It is important to note too that age played a significant factor in how people felt that cost and travel affected them. Of the participants who are aged 18 to 22, 100% of them answered that it would be very difficult for them to travel and very difficult for them to afford the cost of an abortion. These numbers did improve as participants became older, but again, this was a major barrier for most of the women and gender diverse people who took our survey. I think that these quotes here really sum up the effects that the cost of living are having on people's confidence. That figure there, that $100 would cause financial stress, was mentioned more than once in this survey. Moving on to theme 3, stigma and privacy. I'm sure many of you in the room and online have heard something along the lines of, in a small town, everybody knows everybody's business. While smaller communities do have extra challenges that they need to address in order to maintain privacy and confidentiality of their patients, it is reassuring to learn that 2/3 of our participants were confident that their privacy and confidentiality would be respected. Regarding stigma, however, there were many stories relating to shame and judgment that told us that we still have work to do in this area. Less than half of our respondents told us that they would be comfortable discussing abortion, while nearly 1/3 reported that they wouldn't be comfortable discussing abortion with their healthcare provider. Again, we see that the themes in Tell Your Story cross over at many points. In this case, again, access to healthcare provider appointments. When people were able to access a healthcare provider appointment, they were nearly twice as likely to be comfortable discussing abortion against those who didn't have that comfort that they would be able to access the same practitioner each time. And this again demonstrates the positive effect of continuity of care. If I had to choose one word to sum up theme 4, information, education and training, that word would be more. More education in schools, more information for parents, more training support for healthcare providers. This is the theme where women of the Grampians generously shared their ideas on how sexual and reproductive healthcare could be improved in our region. We heard so many great ideas about drop-in clinics, sessions for parents in schools, access to online chat forums. There were so many ideas that just show that there is a wealth of knowledge out there of the people whose lived experience is in this area, and we just need to create a space for them to share those ideas with us. One of the places that people can access information about sexual and reproductive healthcare is 1-800-MY-OPTIONS. And it was reassuring to know that 1/4 of our participants had either heard of or utilised 1-800-MY-OPTIONS. 1-800-MY-OPTIONS is a free, statewide, non-directive, non-judgmental sexual and reproductive healthcare line that you can access by phone or by internet. Of the participants who had utilised the services of 1-800-MY-OPTIONS, we heard glowing reports of how helpful and informative the care that they received from the 1-800-MY-OPTIONS team is. And I think that this quote here really sums up the amount of relief that this person felt once they had a clear idea of the steps they needed to take to obtain the abortion that they needed. Unfortunately, less than half of our respondents were confident that they could access an abortion if they needed one. And the more barriers or challenges that participants faced, the less likely it was that they would be confident that they could access an abortion. You can see here on this slide that participants were 3 times less likely to be confident they could access abortion if they had multiple vulnerabilities, such as being under 33 years old, living with a disability and having difficulty accessing a regular healthcare provider, with only 20% of that population being confident they could access abortion, compared to 59% of those who didn't identify with those groups. The final theme from Tell Your Story was pain, pain relief and sedation. This theme was a late addition to the Tell Your Story project, as we didn't initially set out to ask questions about pain or women's experiences of pain. However, multiple women mentioned pain or the lack of access to anaesthetic as a factor in how they made decisions about their contraception and abortion options. I heard again and again about women who were choosing not to get an IUD placed because they were afraid of the pain or felt like they were not offered adequate pain relief for the procedure, which shows that this is an important factor in how women choose contraception. We know that IUDs are a cost-effective and very reliable method of contraception, yet in Australia our uptake is low compared to other developed nations. And I think it will be very interesting to explore this theme further. And I wait patiently for the results of the recent or current inquiry into women's pain that is being held by the Victorian Government. And I am proud to say that Women's Health Grampians was able to amplify the voices of women who shared their experiences of pain within that report. And that these voices of women in our region can then be used to influence meaningful change. This slide is titled Conclusion, and I'm sure you were all hoping it would say something like Steph's 3-point guide to fixing all of this by next week. But I'm sorry to disappoint. These challenges are complex and will require ongoing significant investment for us to be able to rectify them. I have got good news though. There are thousands of women and gender diverse people in our region, each one an expert on their own lived experience. All they need is a seat at the table and a safe and supportive opportunity to tell their story. This Tell Your Story report contains a wealth of knowledge that can be used to inform the review and development of sexual and reproductive health care in our region. But it is just a starting point. Women's voices need to be included in service design from the planning phase through to delivery. And myself and the team at Women's Health Grampians are committed to helping make this possible in any way that we can. So please flick us an email, get in touch. We would love to work with you and your organisation to see how we can implement changes to centre the voices of women and gender diverse people in how we make changes to sexual and reproductive healthcare access in our region. Thank you.
Thanks so much, Stephanie, for that really comprehensive overview. And thank you as well for the care, the compassion and the commitment that you put into this project over the past 12 months. I think it's really been all the better because of the passion that you've brought to it and your desire to truly represent women across the region. I now want to introduce Shannon Hill, who will be known to many of you. Shannon, I think, has had a huge investment in this piece of work. Shannon is the Sexual Health Advisor at Women's Health Grampians. She's the longest term staff member that we have on board, and that's not to say that she's not a reflection of age, it's a reflection of dedication, I think, and a real belonging in this space. Shannon has had a vision for this piece of work for a very long time, and we were very fortunate to be able to get the funding to get Stephanie on board to be able to see it through to fruition. But I think that, you know, your guidance and strong understanding of the context of our region really helped to shape this to the great report that it is. So Shannon is now going to lead the panel discussion, and I think you're going to invite those panel members up, aren't you?
We are.
Thanks,
Can we
Shannon.
have Sharon? I feel like we need to give you like a standing ovation as you're coming down. So we've got Sharon Cook, Kathy Tischler and Juliana Betts. And we're going to sneak Steph in there too because we thought that wasn't enough time, so we thought we'd pop her in there as well. So have a seat anywhere you like and I'll give you your proper official... Does that work? Yeah, okay, good. So I'll start with Juliana. Juliana has been so kind to jump in and help us today at very short notice. Thank you, Juliana. So Dr. Juliana Betts is a public health physician and she's leading the Sexual and Reproductive Health Plan for Grampians Public Health Unit. And we've loved working alongside you, Juliana. And then we have Dr. Kathy Tischler from Federation University. Kathy is the Research Fellow and Lead Researcher for the Future Regions Research Centre here in Horsham. Kathy's research focuses on economic and social development in rural communities, exploring issues of change and resistance. She regularly conducts research in a rural setting, working in the fields of rural and regional development, social justice and practice change, all things that are very dear to our heart. Thank you, Kathy. We've got Sharon Cook joining us today. So Sharon needs another special mention, has been my mentor and guide the whole time that I've been at Women's Health Grampians. She was the first person that I was told to go and talk to. They said, Sharon will know what's going on, and she absolutely has. And I really thank her for her guidance over my time at Women's Health Grampians. Sharon Cook is, can we say is a registered nurse? Is still, is a registered nurse and midwife.
Just dropped the midwifery in the most recent re-registration.
Okay. Sharon has done everything that we could possibly ask of her. She's been a staunch advocate for women's sexual and reproductive health in Western Victoria for over 30 years. She's championed the right of rural women to make their own reproductive choices and worked tirelessly to identify and overcome the barriers to essential services in the region. And Stephanie Cooper, who you've already met. So what we wanted to do was just have a chat and thinking about the report, thinking about your reflections. So we did give you the report a little bit ahead of time so that we haven't sprung this on you just today. But Sharon, the things that have emerged from the report, I'm imagining that you see those things commonly. Are there things in the report that have come out, the barriers that you see that really impact rural women the most?
Thank you, Shannon, for those kind words. And it's a bit nerve-wracking to be here, but it's been great hearing some of you speak. And Jessie, I think we need to honour women going back in history for having made access to abortion legal in 1969, but not decriminalised until much later, as you said. So it wasn't always that hard for women in rural areas either. I mean, going back 40 years ago when I ventured up for 9 weeks nursing from Melbourne, it was much easier. Local GPs would see women, would refer them. We had a gynaecologist here in Horsham who would perform surgical terminations of pregnancy. I've not completely clear, but I think it was about 2008, 2009, the last provider of surgical termination of pregnancy left Wimmera Healthcare Group, and then there was no service. In 2012, medical termination of pregnancy passed legislation, and I was working as a family planning nurse then and was trying really hard to get a local provider on board. Took me until 2019 to make that happen. And certainly I was possibly still influenced by the pressures that society would have some of us be pressured by, but no longer. Working with women and reading more in my retirement, I've become a fan of some great works that have really reinforced some of what you've been talking about. But yes, certainly prior to 2019, when we had a local GP come on board, all those issues of transport, cost, childcare were factors, and the stigma the lack of anonymity. It's really hard. I would always say to women, you're going to see me in Kmart, and please don't be concerned. I've had women who know me come and see me, and they know that we're sworn to secrecy. And it's, if anything, it's a trust that is quite unique to us rural providers, and we can provide perhaps more ongoing support too. So I'm probably diverging a bit, but even having the local service, we wanted women who lived outside a 65-kilometre. I'm pointing to my wonderful succession plan here, Selena Pilgrim, who I'm so grateful to have when I retired last year. So some of those women would be coming as far as the border, but we had to make them stay within a radius of a 24-hour emergency hospital. Most of you would know that the smaller regional hospitals now don't have access to 24-hour emergency services. And so that was I remember one woman stayed in a motel and arranged for her mother-in-law to mind the children, and she made a bit of a time out of it. But I remember offering my home to some really, strapped for cash women. So does that answer the question? Thank you.
Do you want to add to that sense of care? So when people do find the care locally, how that came through in the report?
Yeah, absolutely. So there was a lot of stories that paint a picture of doom and gloom that came through Tell Your Story, but there were also some really wonderful stories where women had accessed the care that they need, the care that they wanted. It was local, it was comprehensive, and the sense of relief was palpable through the way that these women wrote their stories. We know that an unplanned pregnancy can be life-changing if you aren't able to access the care that you need, whether that's abortion care or maternity care. And it was very clear that access to people like Sharon or Selena, having a nurse or a doctor or a midwife who is in your corner, who you can trust, who you know is going to get you what you need and take your secret to the grave, it really made the experience so much different for those women, and they were so grateful to be able to receive that care.
Thank you both. Kathy, I was going to switch to you, if that's okay. I was thinking about the aspect that Sharon was alluding to there about rural. How do we attract more workforce into rural spaces that we need them? Is that a good question for you?
Absolutely, that's my favourite question. I'm just fangirling to be on a panel with Sharon. I love and admire Sharon's work so much. She changes lives in our region, and I know she's recently retired, and that I'm very happy for you, Sharon, because you deserve it, absolutely. But you've changed so many lives in this region, just quietly and carefully and with such professionalism. So I just really want to acknowledge that and say thank you.
I'm very humbled, but I've got Women's Health Grampians to thank, along with lots of other organisations and people but thank you.
I know it's always a team effort, but one of the wonderful things in our region is that a person can make such a difference. And I think that's one of the attraction points for people in an industry like yours, is that if you come to a region like ours, one person can make an incredible difference to so many lives. And I think a lot about Band-Aids on problems, and I think there are some really important structural things that we need to do as a region, and I'll talk about that in a second. But sometimes some really well-placed band-aids with people who are passionate, just a couple of people who are passionate about making a difference in the region can actually change so much as well. So first, if we're going to get a better result in our region, first I want to acknowledge the people who do that amazing band-aid work. So thank you, Sharon, and thank you to all the teams who work with Sharon, and we'll be working with others in the future because that helps us hold the line. Now, I'm a regional development specialist, so I'm always looking at the big picture around change in our region as well. So I think there are some really important things we need to do to reinforce the importance of rural livability as a region so that we can attract people here, so that we can retain people here. And I think we've got a really, really significant policy job to do. And this is for us as all rural people, not just the people of Horsham or the people of Stawell or the people of Birchip, but we've all got a really important job to do to say, look, we're here in the regions, we're doing a really important job adding to the gross domestic product of our nation. We're supplying food, we're supplying fibre, and we're about to supply a whole lot of energy for our urban populations. We actually need to be appropriately resourced to make the communities that we have here livable so that we don't have a two-tier society where people out in the regions are expected to accept a lower standard of living and a lower quality of life. So that's a very, very ambitious task. And I really hope to not be doing that on my own. So, and I know there are a lot of other people passionate about that, forcing that change as well. But I think it's something that we've got to keep really focused on because there are so many of these challenges, the challenges in women's health, the challenges in education, the challenges in making our communities and supporting them to be diverse and to give people the opportunities in everything that they want to achieve. But we really need to maintain a focus on why rural communities are important and why rural communities need this support.
Juliana, do you mind if I switch that? That feels like a big thing to follow, but I thought you might have some thoughts around the public health aspect of that. How do we attract and retain the workforce that we need? Is it all sexual and reproductive health specialists that we bring to the region? How do we do this?
Yeah, thanks, Shannon. Definitely in the medical and healthcare space, this question has been asked for quite a long time. How do we get rural people to work in healthcare or come out to the regions? And there's lots of things that have been tried. So, obviously there's the rural medical schools have been trialled out. There's been a lot of funding to try and encourage people to come. And to be honest, none of it has really been very successful to date. So I agree that we need to think of some new sort of creative solutions to this, and very much agree with what Kathy had to say. I think that also we need to think about expansion of the nursing role, not just as a band-aid sort of solution, but actually there often are great permanent nursing workforce in a lot of rural areas, and they are often great leaders, as we see that Sharon has been and continues to be. I think that nurses working to the top of their scope and being able to provide these sort of services, particularly to women, is a really great opportunity. There's also obviously emerging technology and things, so looking to enhance telehealth models I think is a really great opportunity in this space, particularly for people living quite rurally or remotely. But obviously there's challenges with that as well around access to internet or people with disabilities or other cultural needs where that might be challenging but not necessarily not overcome, just needs to be well designed. And definitely the sort of bringing the health and the social care together and forming those activated networks within the community. All of those elements have been shown to be successful for pregnant women and young children, and a range of other health issues as well. And I think it really could be quite applicable to the sexual and reproductive health space. We don't necessarily need the sexual health specialists on every corner, as much as we'd love to have them. But what we need is for everybody to make this part of their everyday practice. This isn't any different to wound care from our perspective. Everyone knows about wound care. Everyone knows how to take a blood pressure. This is the same thing. This is a fundamental human right. This is healthcare. And yeah, it absolutely just needs to be on everyone's radar, and everyone should be able to do it.
Amazing. Do you have any reflections on that, Steph? I know that privacy and stigma has been on top of our mind.
I think what you were saying, Juliana, makes so much sense, and I found myself nodding along, especially when you talked about nurse-led models. And I will admit I am a little bit biased here because I am also a registered nurse. But there was a really interesting statistic that came out of Tell Your Story, which was 87% of people who took the Tell Your Story survey said that they would trust a qualified nurse or midwife to provide them with contraception or a medical abortion. Which is an overwhelmingly positive statistic. There was a quote here where they said, "The nurses were so wonderful. They didn't judge or lecture me. They held my hand through the whole thing. It was so reassuring that they all knew exactly what was going on and what had to be done. One of the nurses called me a few days after the abortion to check that I was doing okay, and this made a difficult thing so much easier." So I think that really ties in with what you were saying, Sharon, about that level of personal care that nurses can provide, and that in a rural area, it really makes sense to be making the most of every health practitioner's scope, and there's not any good reason why a nurse couldn't be equipped to provide a lot more sexual and reproductive health care than they currently do.
So many questions, let me think. So, Kathy, we were also interested in the aspect of this being rural and regional focused research. Do you feel that it's important to have this rural and regional focus? Is that research needed?
No, urban people understand everything. Look, it's absolutely critical that we have the rural message and the rural lens come across every policy decision that's made around women's healthcare, reproductive healthcare, and every other policy issue that exists. The reason why I'm a rural practitioner is because once upon a time, I grew up rurally, but once upon a time I lived in Melbourne, and 90% of my job ended up being translating the rural experience to urban policymakers. I was a policy specialist, that's where I started, and making sure that the rural message was included and given value in policy decisions and investment outcomes was absolutely critical. And now I live rurally because I think if you want to tell a rural story, you should live in a rural area and be a rural person. So I came home to do that sort of work. And I just think it's like in everything that we do. If you don't have the lived experience, it's hard for you to include that message and have that message expressed in the work that you do. So it's not that urban policy makers are less skilled than everybody else or they're willfully ignoring rural people. I think that it is just critical to have the evidence base, the statistics and the stories, and bring all those things together to be able to continually reinforce in policy settings why we need a rural focus, why a one-size-fits-all is not necessarily a great outcome for good policy and good growth and good livability in all our communities. The Tell Your Story work is absolutely critical to putting some stories behind the statistics about what's going on, and I think there should be more of it, absolutely.
We feel so lucky that we've had the chance to do it. We don't always get the time to do such a big consultation, but it's really been super valuable to our understanding of the issues and how it impacts, the end person when we don't get it right. Sharon, I was thinking about, in your experience, this could be a double question, but is there something that you would like to see? Is there something that you're wishing for, hoping for to change, or is there something that you've seen change that has been really effective?
Thanks, Shannon. There's so much I could say, but it's already been discussed in the report, and I've always been of the belief that we need to have conversations and education. When I was first appointed as family planning nurse way back in whatever year it was, I think it was 1997 that a local GP in Nil sent me to do the family planning training in Melbourne, because he was aware that a lot of women felt more comfortable seeing a woman for that sort of thing too, so that was quite progressive. But when I became family planning nurse, one of my first actions was to start education in schools. I'd seen very young teenagers giving birth as a young midwife coming from Melbourne, and I thought, I can't do this on my own, we need parents. So we did start the nights in primary schools, and I hope they're still continuing. And it was more about helping parents have the conversations to have with their young people. And I know Shannon sat with me once with a Year 10 group. Year 10, we could start to get a little bit more into, unplanned pregnancies and things, but had some really great educational evenings where I think the change really happens. The stigma is such a big thing in rural areas, and I've always been really careful about what I say too. And now that I'm retired and not affiliated with an organisation, I'm still, my daughter, who you've probably worked with, she says, be careful, Mum, because we do have conservative population groups, but we can change. And I've seen people I've worked with change once they realise, when they really work in the area. And I listen to politicians and I think, come and work with me for a couple of weeks and you would see things very differently about some of the policies that you're making. So I think we all as people have to, one, normalise the conversation. It's a human right. Access to abortion, access to reproductive health is a human right, and it's health care. And it shouldn't be something that is absolutely a different topic under the shelf. I was thinking in the lead up to today, I finished my career when COVID hit, and my kids didn't want me dying with my chronic asthma. I was ferried over to the quieter area of palliative care, where I spent part-time work while still working in my women's health role 1 day a week. And I was thinking, if people decided not to have treatment for their cancer, they were allowed to. And I just think, why shouldn't women be allowed to choose the treatment for their future life that they want to as well? And it shouldn't be separate. So again, we need to have the conversations, we need to normalise things. I'm happy to discuss further with anyone. I just I do go off sometimes. I watched a really inspiring interview the other week with Sarah Ferguson interviewing Marsha Neve. She's the Commissioner of the Royal Commission into Family Violence. And something that really resonated with me when Sarah asked, do you think we can change? She responded by talking about the program, Healthy Relationships in Schools. She said she was pulled aside by a young child who said, do you do these for parents? Because my parents need to come. and I think that we can change from the bottom up too. We're not going to change conservative attitudes in some people, but I have them. I've been confronted by some of my long-term neighbours. I've lived in the region for 40 years, and I'm quick to say, why wouldn't you want to help a woman choose to care for the children already in her care and make it harder for her? And yes, I'll stop there, but I might just check my notes and come back at that. Thanks, Shannon.
Do you have any thoughts on that, Steph? We did have a question come through the Slido saying, how do you see the report impacting change locally? That might be something that to start with you.
I'm really hoping that the statistics that come out of this report that show how younger people were more affected by these barriers will invite more education into schools and into spaces where youth are, and also parents. I think that including parents in the conversation is really important, and that is one way that the stigma can be broken down, is if we can give parents and young people the tools to have these conversations about how that young person is going to manage their sexual and reproductive health. There was one story that came through about where a woman mentioned that she was having to keep the abortion that she had secret from her parents because she was afraid that they would judge her or they would try and force her to have the baby. And I think that if we can normalise the fact that these conversations need to be had, and even if they're a bit awkward and you don't really want to talk to your mum about this, but it does need to happen, and it should be just part of growing up, is that you, in the same way that you need to teach people how to manage menstruation, that we should be teaching young people how to manage their sexual and reproductive health care, and having a proactive rather than a reactive method of how we approach this.
Juliana, I know you've helped us do some work locally. Is there something that you want to mention about locally? How do we use this report locally to inspire change?
Yeah, thanks. I think definitely hearing the stories is so powerful, but also hearing that there's some good happening too shows that it's quite hopeful. There's, if we just get some good services on the ground and available and accessible, which is the key point, then we know that people can have really good experiences and good outcomes. So yeah, I think the key is that access issue. For me, in the report, that's a really big standout element, and it covers probably a lot of the other themes as well around stigma, confidentiality, and we know that part of that can also be the practitioners who don't have confidence or skill. I mean, that can be stigmatising as well and impact your access. So these stories are really powerful, I think, and really will look to inform the design of future services in the region, which we're trying to work locally with services to improve access. So thanks.
Kathy, is there a wish that you have? Is there something that you can see as a future or a hope that might help us look to what we change next, or what you might like to see as a change?
Perhaps just before I talk about that, I'll go back to how do we see the report impacting change locally. For me as a regional leader who was once young but is getting older by the day. We all are. I don't know how this happens, but I think one of the really standout things from the report for me was how age impacts your experiences. And I always love reminders and wake-up calls, particularly, you know, to reinforce what's not my lived experience but other people's lived experience. And I don't have a lived experience of being a 22-year-old at the moment, sadly. So I think as regional leaders, there's a really important message for us in this report that to check our own privilege as well. As we get older, many of us have the resources to go and access healthcare, reproductive healthcare and other forms of healthcare outside the region. And we need to be really, really careful that our privilege doesn't reduce the quality and experiences for people who don't have our privilege to be able to do that. So that was probably the take-home piece from this report, is that we all need to really retain a very strong focus on having quality healthcare and a breadth of quality healthcare in our region so that people of all ages can have the same opportunities to access what they need to, when they need to, in a timely and safe manner. So that's the message I'd like to leave people. I think we all need to think about what we do and what we say to help make that a consistent reality in our region going forward.
I love that. I might get you to all sign your life away. I'll put that on a note and say you're all going to commit to that before we go. We do have some questions popping through, but before we do that, does anyone have any final reflections or things that they wanted to add? I can pass it down.
We're going to start with Sharon.
One thing we haven't spoken about is why has it become harder in rural areas over the years for women to access termination of pregnancy? And I don't, I mean, we know, but I wonder, I can't do that on my own, but I wonder if some of the people further up the ladder than me have any thoughts as to how we can get our local health professionals to be able to provide more equitable services?
I think the answer to that comes back to breaking down that stigma. We know that there are healthcare professionals who are conscientious objectors to providing abortions in our region, and that conscientious objection is protected in the Abortion Reform Act. I think that education for doctors around what that means and the impact that that has is really important to ensure that those doctors, if they choose to conscientiously object, are doing so because of a strongly held personal belief and not because they think that's what all the others are doing and that they're just wanting to fit in with what their colleagues are doing. So I absolutely respect that abortion is not for everyone, which is why I am pro-choice, and that choice is for the person who's making that choice. And I think too, another part of that is reinforcing to doctors that do conscientiously object to providing abortion, or nurses or midwives, any healthcare providers who object, that they do have an obligation under the law to refer that person to a provider who does not have a conscientious objection to providing termination. And I think that that is where the system is currently falling down a bit, because we don't actually have any way to measure if that is happening unless women tell us. So unless women are coming forward with those stories, which is what has happened in the Tell Your Story report, because we created that opportunity for them to tell that story. But if you're 7.5 weeks pregnant and you've only got till 9 weeks to find someone to provide an abortion, top of your list is not going to be writing to the health minister about the doctor that conscientiously objected and didn't refer you on. Your focus is going to be getting the care that you need. So I think that there's definitely more education and more work to be done, but I don't think that that's an impossible problem to solve if we really commit to education and making those changes.
We did have a question around conscientious objection, and I just want to add that we are very fortunate to have very strong partnerships with the likes of Grampians Health, with the other health services across the region, so East Grampians Health, West Wimmera, with Western Victoria Primary Health Network. They've all been really supportive in this work. So we've had the best, I guess, partnership and collective work across the region. So that is always part of our mission and our aim, is to make sure that we are thinking about conscientious objection and how to overcome that, and making it easier. Say, for example, for a health service to make a statement about their support for abortion and reproductive health care as a public thing. So that's always something that we do have an eye on. Juliana, there was a question for you there. Can you see that? Juliana, you highlighted the role of nurses. Is there still resistance to this amongst the medical fraternity?
It's a good question. I can't speak on behalf of all doctors, obviously, but many GPs that I have spoken to actually really are keen to support their practice nurses to be able to do more. I think they find it very frustrating, the current system barriers around that, such as they can't get any remuneration for the work unless they physically eyeball and see that patient, and the practice nurse isn't able to charge the MBS and bring in funding, for example. So actually I think a lot of GPs are very supportive of expanding the nursing role and helping them to be able to do this work and serve the community. But to Sharon's point around the barriers here, I mean, it comes back to the essence of many barriers for lots of health issues in our region, and we see that life expectancy is actually lower across all of the Grampians region compared to Melbourne, and that's a really unfair, avoidable situation where we see that primary care is that business model and it's failing rural areas. So we need to think differently about how we do it, and I do think that nursing role has a lot of opportunity.
Kathy, did you have any final thoughts or reflections that you wanted to add?
I think I've had a fairly good go. Look, I just say that I think this is a really critical piece of work that adds to the information that we have to drive change in the region, and affording people the opportunity to tell their story and to highlight some of the challenges and also some of the good things that can happen in our region around reproductive health and reproductive rights has been really important. And I think for me in the regional leadership space, this has given a bit of a platform for us to keep this in front of the eyes of those in government and those in the regional development space who need to be continually thinking about the breadth of things we've got to tackle in the region. So making sure that women's health issues aren't forgotten or being considered a lesser issue is a really important outcome, I think, from this piece, because it's new and fresh. It's got really strong stories to add to the statistics about what's going on, and we can use that with all our partners like Women's Health Grampians, the health service networks to reinforce why this is important and what we need to do to change. So thank you.
Is there any questions in the room? I've got the questions coming down in Slido, but if anyone really hates typing them onto a phone, you can feel free to just stick up your hand if you want to say something. There is a question here about noting that within the report, Steph, we saw that women with disabilities have additional barriers when trying to access services. And is there any plans to delve deeper into women from marginalised communities living in the Grampians region and their experiences?
I think that's a really great question. One of the things that we decided when we were writing this report was that we didn't make any hard or fast recommendations within the report. We just drew conclusions with the plan that we would then engage with partners, with community groups, with health services to take the information from this report and implement it within their organisation or their service. And I think that can apply to any vulnerable group. So in this case, referring to women who live with a disability, absolutely that Tell Your Story showed that those women did have more barriers to accessing care, and we know that rural women have more barriers to accessing care, and we know that those barriers compound, and the more you have, the harder it gets. Which is why I think that the next step from here will be working with partners who are specialists in that area. So, for example, Women with Disabilities Victoria would be, I don't know if any of them are joining us online, I think they might be, but you know, I'm really hoping that I'll have an email in my inbox saying, hey, let's work together to see what changes we can put in place to help women with disabilities, and that we can use this report and interpret it in the way that's going to help this particular community, this particular organisation, because, again, they're the experts in their own experiences.
Some people are putting really tricky questions down there. Are you reading this with me, Juliana? I'm looking at you. There was a question around religion. So did we feel that perhaps religion or religious views as a barrier came through in the report? And I think I can sort of say from Steph, I don't really feel that religion was mentioned. But interestingly, thinking about how does this affect Catholic schools and what Catholic schools choose to educate on or not educate on, do you have a view about that? It's a bit early on in our thinking about schools, but I didn't know if you wanted to add anything.
I think it's about finding the common ground, actually, and many teachers are very supportive of this work as well, and many religious-based organisations are supportive as well. I think they recognise the same access issues, and many respect the choice element as well. But ultimately, you know, I mean, more broadly around sexual health, we think about in the young primary school ages, it's really around, you know, consent and respect for relationships and child safety as well, and that's a big priority in many of the religious schools. So yeah, finding that common ground, but generally I think actually I haven't come across anyone that's not supportive of it yet. Maybe that's just me, but yeah, I think it's been quite widely supported.
Just to add to that, I think that really reinforces the importance of not putting all your eggs in one basket and just saying, well, that's going to be the school's responsibility to do that. Because if you have a school that is choosing not to provide the full spectrum of sex education for whatever reason, those young people are potentially missing out on education. But if they are able to get it in another way, whether that's through a service like Headspace or through an online service like 1-800 My Options, or their parent has gone to an information night that's been run at a neighbourhood house, for example, then that person is more likely to be able to access that information even if it's not through school. And I think that also acknowledges that there are a lot of young people that are not linked in with the school, especially after COVID-19. We saw a lot of young people disengage with school services. So we need to be really creative in how we make sure that our young people are not slipping through the cracks if they're not going to a traditional public education program.
Sorry, I'll just add too, I had written women and men normalising the discussion earlier on, and certainly when I was working in a clinical role, it was always good to include a male partner, and the resources that myself and my colleague Selena used from the Royal Women's Hospital, Children by Choice, had a lot of information for men, and it was one time when I could presume their partner was male, that resources to help support their partners, some really great resources there. So, thank you.
I love that. And in some of the stories, there were quite a few that said, what about men? You know, what about, how do we get men involved in the conversation? There was a question around how do we affect, I guess, long-lasting change in trying to engage policy and decision makers. And this report is really the start of a conversation. So we use this to prompt the thinking, so to stretch people's thinking beyond what is available now and what we can perhaps afford in public health now and what is possible with the workforce we have. We want to stretch their thinking and think about what else could we do with what we have available in the region. So you have our promise that we will continue this work and influence that change. Where to next? That's up to you. So we're really hoping that you would invite us into your spaces, into your networks, into your communities to have these discussions. So it might be with youth groups, it could be with schools, it could be with healthcare professionals. We want to use this to prompt that conversation, to think about, what does this mean to you? Do you have this experience? What information would be most beneficial for you to make a change in your personal service access, or right through to the planning of future health services and where they're located. So I think that, is there any other questions there that you really wanted to answer? We could probably sneak in one more. One more? Can you find one? I haven't got my glasses on.
So I think the question here is, how would you like us to support the findings and affect change for improved access in our communities? You can start by scanning that QR code to the evaluation, because there is actually a section in there where you can put in your ideas and let us know what you would like to hear more about. If there was a particular theme you'd like to know more about, if you want us to come and do a workshop with your organisation, if you want more speaking events. Where to from here is us partnering with other organisations and working as a team. At Women's Health Grampians, we're really good at connecting people to the information that they need. I like to think of us as like the telegram workers, or with the old telephone exchange with the roller skates, that we're just sort of plugging people in to connect them to who they need to speak to. So please let us know what you want to happen with the report next, and we really look forward to working with you on that.
Thank you so much for your questions. If we didn't get to any, we might try and follow that up with an email at the end. Thank you to our panellists. That was really helpful to have your thoughts on this. And I will hand back over to Marianne.
Thank you so much, Shannon, and all the panel. That was terrific. You did a beautiful job. Look, I just wanted to say a quick few thank yous, and to wrap things up. I see that Stephanie is about to make presentations to each of our wonderful panellists to acknowledge your time and effort in coming here, so thank you for that. I also want to thank our Horsham staff in particular, who helped to facilitate and set up this this event today. That's Melissa and Vanita and Katya and Claire as well. I really want to thank so sincerely those who took the time to contribute to tell your story. And I really hope that you feel your stories are represented in the way that you intended through this report, and that we honour your experiences. I think that it took bravery to share that story. Obviously, it was anonymous, but nevertheless, for many of those who shared their stories, that could have entailed revisiting perhaps painful or difficult memories or times. And I hope we acknowledge the value that brings to the whole discourse around access to sexual and reproductive health care. And I think stories are powerful, and you are the change makers by sharing those very real experiences, which we will continue to honour by taking to decision makers and policy makers, and really using this information to demonstrate the need for how we should shape and construct, particularly our rural health services for women. Thank you, Sharon. As Shannon said, we intend to undertake a number of different ways of following up on this report, and please contribute to that conversation. I also wanted to acknowledge the partners in the work that has gone before this through the Increasing Reproductive Choices group, which has been in existence across the region for several years. Shannon mentioned some of those players, but Grampians Health, Ballarat Community Health, West Wimmera Health Service, Rural Northwest Health, East Wimmera Health Service and Gulam Co-op have all been contributors. I'm sure I've left someone off the list, which, pardon? That was pretty good. Okay, good. So yes, thank you once again, and keep having these conversations. Safe home, everyone.